Afternoon, everybody. Thank you for taking the time out of your afternoon to show up to this. My name is Rochelle Hazard. I am the Director of Inclusion, Diversity, Equity, and Access. For short, we just say IDEA. So welcome to Neighborhood House's info session. This session came about from us listening to the community and the people that we serve and utilize our services. And we were hearing a lot of things. And some of the things that we were hearing about the needs of the community was around COVID and the impacts of COVID. So people are having a hard time paying bills. They're having a hard time paying bills because of loss of job or loss of hours at their jobs. Putting food on the table. There was concerns about schooling and childcare as well, loss of childcare, accessing childcare, and of course the strain that remote learning is putting on the in and out of school. There was also concerns about how to deal with the stress that all of this is bringing and mental health concerns like the depression or the anxiety that people may be feeling. So in response to that, we thought, what can we do? Well, what we can do is look at what we offer here at Neighborhood House and how this could possibly help. So today we decided that we were going to talk to you guys about our programs that may be able to alleviate or at least assist and alleviate. So we're going to be talking to you about our rental assistance programs, HP and EPRAP rental assistance. Now, I know that you're going to hear, you guys probably don't know what HP and EPRAP stands for. That's okay, because when we talk about it, we will explain to you what HP and EPRAP stands for. We're going to be talking to you about employment and adult education, the training opportunities, and finding higher paying jobs or jobs with more hours. We'll also have somebody here speaking from Community Living about Community Living Connections and caregiver services, how to navigate systems and connect with community services. We have somebody here from our early childhood education, and they will talk about childcare resources, preschool, and Head Start. We also have somebody here who works with our community health, and she will talk about how to connect with the needed mental health and or substance concerns. So here at Neighborhood House, our mission is Neighborhood House builds communities and increases access to housing, health, education, and economic opportunities, right? So we're really here to be with our community, be in our community, and figure out how we can assist in making these things easier and better and access easier and better. And our vision of a healthy, diverse, and welcoming community free of poverty and racism where people can thrive. Right, so that's really about like being in this community, making it so everybody can access what they need in order to live happy and healthy. And so as a part of in living our mission and vision, it became really important that we do this session. So we will get underway now. We are going to start with early childhood education. So we can begin now.
My name is Nan. I'm the ERC supervisor of child development. I work for the recruitment enrollment for our early learning program. Right now, Neighborhood House is enrolling for several different early learning programs in our child development. We have this Head Start preschool for the children from age 3 to 5 years old. And we have 5 different preschool classrooms located in Burien, New Holly, Rainier Vista, High Point, and Yesler. So, and the teachers implement evidence-based curriculums, provide support for dual language learners, and create learning environments that support social emotional growth with the goal of helping our children become ready for kindergarten. Parents also receive our support for different areas such as family health, wellness, other needs, and goals. Our classroom hours are different. The half-day hours will be about 3.5 hours in a day. Morning classroom and PM afternoon classrooms. We also have the full-day classrooms. Full-day classroom is like 6.5 hours in a day.
In addition to our preschool classrooms, we also have toddler center-based classrooms for 1 to 3-year-olds. We also offer a home visiting program that's for pregnant moms and parents of infants and toddlers up to 3 years old. Those are weekly 90-minute home visits where a home visitor can connect with families about how to help their children kind of get ready for their next stage in development. They do a lot of neat activities together and can also offer resources for things that the family might need and help them connect elsewhere in the community. Anything from like job training, housing. We really work with families in all of our programs around their goals. Our Parent Child Plus is another home visiting program. Those are shorter weekly home visits, but they're really focused on literacy and other kinds of learning activities. So they're good for parents who want a little bit shorter, but still focused on education visit. That's a really neat program too. If you're not sure what program you might be interested in or might qualify for, there are eligibility requirements for all these programs are really designed for lower income families, but it's always okay to call and find out. Our programs are typically in the south part of Seattle and South King County into like Burien, Tukwila areas for home visiting, but we can help you figure out where, if you live in an area we serve, and if not, we can help connect you to another program that can help you figure out what you might be qualified for or what might be a better fit for your family. So that's where we would kind of refer you over to Child Care Resources. They can really let you know about other preschool programs, other toddler programs, other home visiting programs that might work for you better if our programs don't. That will also show our programs contact information, where you can find our website, where you can call for learning more about how to enroll in our early learning programs. And also if you think, oh, I live, pretty far north, that's not going to be a program that serves me in Everett or something. Call Child Care Resources, find out what is around you, or what might be good for your family too. So that's it for us.
Wow, thank you both. Thank you, Nan. Thank you, Carly. We are now going to move on to employment and adult education.
So neighborhood house are offering services intentionally and in order to community to be successful. And as you saw, part of our vision is to alleviate poverty in our community. So employment and adult education plays the key role of that, moving people upward, and so that you will have the entry jobs, and then the idea is to help you progress and do better. There's a lot of programs that you probably don't need to remember, but we will just go ahead one by one. But then we will provide you our information, and if you need, then you can call me or Molly at the end of the PowerPoint. You will see those numbers. So the first program is called Basic Food Employment and Training. And that is anyone who is receiving basic food. And what we tell people is a lot of people especially when they're receiving unemployment, may not become eligible for food stamp or basic food. So what we tell them is don't exclude yourself, try it, because what the basic food comes is a benefit for you to tap the tuitions or other things if you go in community college or any other things. So we tell them, people, do not exclude yourself, apply for basic food, see. We say, well, some people say, oh, I only been eligible for $16, I didn't bother in applying. So, but if you apply it and you become eligible, only $16, that is the money to buy food. But what you don't see is the support services and the tuition that's attached to the basic food. Like if you go community college, you will pay full tuition. That's almost $2,000 that you don't see, because you say, well, I'm not going to be bothered because $16. That's easing us to buy food, but comes with other services. So that's our BFIT program. The refugee and immigrant assistant, and Molly, you want to talk about that in depth, or?
Okay, so Raya BFIT is the same, almost the same as BFIT program. It's for refugee immigrant assistance, basic food employment and training program. This is only for refugees who receive food stamp, and refugees who are less than 5 years in the United States are not a citizen yet. That is why it's called refugee immigrant assistance, Raya BFIT.
Yeah.
So, yeah.
Luckily we are live good states, so that means anyone who's not eligible because of the federal money of the program BFIT are eligible Washington state and food stamp. And in order, so our state decided to kind of blend it, so you don't know what the difference. You will still have the same card for you to utilize the the basic foods, but at the end side of it, there's two funding that's supporting that program. So, all right, do you want to talk the next one, Molly?
Yes. Raya LEP is limited English proficiency. This is for refugee immigrant assistance as well. But what's different is for LEP program is for TANF clients. I would say the eligibility, like for refugees who are less than 5 years in the United States can be eligible for LEP program, whether they receive food stamp or not. As long they are refugee and less than 5 years in the United States, they are eligible for LEP program. And if they are already a citizen more than 5 years, but still receiving TANF and English level below level 6, can be still eligible for this Raya LEP as well.
All right. So next program, and it's called WIOA, Workforce Innovation and Opportunity Act. It's a federal fund that comes through the employment security and then trickle down to workforce. And just give you a general idea, in Washington State, there's 12 workforce, and in King County, we are lucky to have our own Seattle King County workforce. So, so our county just has its own workforce. So the money comes to the workforce, and we are one of the recipients of that WIOA fund. And it divides in a couple of categories, mostly WIOA adult, and that is income-based and has priority of the lower your income, the top of your priority to be served. And the other one is for dislocated program, and anyone who's been laid off from their job or receive unemployment or exhaust unemployment are eligible for those programs. So neighborhood house, because what we've been doing in the community and especially last 2 years of the COVID time, and we've been recognized about our quality of service that we're providing, so that we also been awarded and 2 other small grants that comes from Washington State. One is the Economic Security for All and Hunger Relief. And basically, it's 2 small programs that support the community. The Hunger Relief is mainly supporting, food banks and other agencies like Fair Star or other community-based organizations that providing either senior meals or some food-related programs. And so we work with those agencies, and we provide the salary of almost 7-8 people that's going to be supporting those community and doing the job. And whether it would be a delivery driver or the cook or whatever needed, that those agencies needed. So Economic Security for All is also another grant that we could support it, that goes along with WIOA adult format that help the people who are far away from opportunities to tap the services and the tuition money that comes with it. And all of our programs has what they call individualized employment and training plan. You will sit down, you'll be paired with case manager 101. You create plan with them. and hopefully you have career path. At the end of it, the idea is to put you in a job that pays you self-sufficiency. We have case managers who will speak multiple languages, and also neighborhood we have a lot of people who speak different languages. So we try to pair in people who with those case managers, but also utilize our own language capacity. And if not, we always utilize kind of a interpreter via phone or one-on-one if it's going to be in person. So as I was telling you earlier, you will create an employment plan and training plan that hopefully comes out in base of your needs and the assessment. And so a lot of time people wanted to do career assessment to kind of either support about it, what they already have in mind, kind of, say, hey, well, this is what always been thinking, or kind of creates you a kind of spark where you say, oh, now I know why, I always like to do these things because this is what the career assessment says. And then now I'm not to embark in that kind of career. And then we will help you pay the tuition and give you the jump start into those programs. We are very connected in the community colleges and also in private schools that provide services in the training side. And what we are intentionally providing what they call wraparound services, where you will be assisted and see your needs in terms of transportation. If you going for interview and you're ready you need interview clothing, or you get a job, you need the boots or clothes that needs in that environment where you're going to be working. We are there to support you, and we will be helping you with those support services, but also we will going to be providing ongoing support. Once you get the job, we will be there for you next 12 months and provide you, support, provide support. And once you get the job, within that 12 months, you can always come back and say, hey, I want a better job, and you still work with you and find you a better job. Next. So both Molly, Claudia, who's not with us, and we work close, and you can, because neighborhood house itself has what they call no wrong door. So whoever you come in contact, can help you guide through those, services that we provide. So if you need anything about employment, adult and education, and if you are South End, you can call Molly, and any part of King County, you can call me. And Molly's number is 206-272-0044. And my phone number is 206-588-3878. And Rochelle, if you will have opportunity at the end of for a question and answer.
We're going to take a minute here. There was a question in the chat for childcare, and that question was about if there were fees for our childcare. And I just want to clear that up and let everybody know that the preschool and kindergarten is free. There's no charges for that. Ms. Ella, I see that you've had your hand up. If you have a question, can you put it in the chat? Katie Lewis, thank you, Katie, for putting this in the chat, reminded us the Neighborhood House also has a program ready to work for ESL class. So can you talk a little bit about that really quick? Or can Katie talk about that?
So that program is located at High Point, and we have a program called Ready to Work. The idea is to, people are, in level maybe 3 and 4 and 5, I think, who are working with their ESL language, the English language, and also prepare them in a language, not just learning general English, but learning English that's needed at the workplace. And the idea is to prepare them to get to work. And that class has maybe a couple of teachers that's supporting you, plus Katie, who's the employment plan case manager. And then the idea is to, go to school in the morning and still able to find job search and maybe able to find job at nighttime, or so you can balance between school and work. And that one is based on High Point. Since now it's online, I'm not sure if it's open to other parts of King County, but
Well, Katie has put her information, her contact information for the ESL Ready to Work class in the chat. I'll read out her phone number really quick is 206-335-6170. And her email is in here as well. And that's Katie, KATIEL at nhwa.org. If you are interested in this class, or you know anybody that's interested in a class like this, please reach out to Katie. Thank you, Ali. There's another question. Do you have immigrant lawyers?
and we don't have immigrant. We don't have lawyers based in neighborhood house, but we are in touch with the immigrant agency that provide immigrant with the that issues with the law and connect them to this program, whether it would be citizenship or anything that kind of creates a path to employment.
Who would they reach out to for that, Ali?
And ideally anyone, and because of if related to employment and work, employment document, things like that, you can reach us and we will find some resource for you.
There's another question in the chat asking by Mike Graham, and Mike asks, are any of our employment services available for people who do not have documents?
Yes, and actually we had a grant from King County that would be called a flex money, and we still do have some other flex money that we can possibly help them people who are undocumented. And then the idea, if we can prep you and do everything, is then finding the job is more about the legal part of it, and then a lot of people decided to create their own LLC where they can accept a contract and become self-employed rather than going to work.
Thank you. Okay, I don't see any other further questions coming in, so we are going to move on. We are going to talk about some job opportunities that we have right here at Neighborhood House, and it is Zeb is going to join us and just let you know what's happening here if you're interested. Good afternoon, Zeb.
Hey, Rochelle. Hi, everyone. I just wanted to take the time to kind of promote the job openings we have at Neighborhood House for Neighborhood House jobs. So I'm the recruiting and onboarding coordinator. I work over in our HR department, and I do all of our job postings and help with writing job descriptions and kind of everything related to that. So I just wanted to share the kind of like types of jobs that we have at Neighborhood House that are open right now. And right now, our highest need, we currently have over 50 jobs right now. Hiring is really tough. There's a lot of job openings and not a ton of people applying. So right now, our highest need is in our child development department. We have a lot of teacher positions. So if you are interested and qualified or know of anyone that wants to teach preschool, we have a ton of openings and we'd love for them to apply. Unfortunately, there are pretty strict rules around education requirements. But thankfully at Neighborhood House, we do have support in our child development department that helps you figure out the right classes that you would need to take if you're interested in becoming like one of our lead preschool teachers. So that is kind of the most jobs that we have right now, but we have a variety of other jobs in our other departments as well. So we have several case manager positions in our Aging and Disability Services team. There's a lot of language requirements for those. I know we're looking for someone who speaks Ukrainian and Russian. There's a Marshallese case manager position, and several others as well. Best place to find all these is on our website as well, which is linked here, and I'll drop the link in the chat as well. We also have a couple housing positions open, maybe one or two. I think we have a housing advocate position, and we may or may not have the EPRAP eviction prevention temporary one as well. And then we also have a community health case manager that we are looking for as well. And then that's kind of, we actually are also looking for a couple HR positions. So if you know anyone who has experience with HR, we have that as well. And yeah, I think that's generally everything. We do have an upcoming posting coming out for a education specialist that's bilingual in Vietnamese over at our High Point location as well. And I think we're also looking for a coordinator, a youth coordinator, so after school programming coordinator for our High Point location too. I think that's everyone. We also have other child development positions like a home visitor position and a family advocate position, which is also related to home visiting, and a associate manager position in child development. But you can see all of those on our website there. And feel free to reach out to me if you have any questions about those jobs. I will put the NH Jobs contact info in the chat, and I'll also put my phone number there. And I'm happy to talk through any questions you may have about our jobs. And we definitely encourage all people to apply. So yeah, thank you all.
Thank you, Zev. So I encourage anybody who's interested in any of this, please reach out to Zev. You can go to our website as well to see the full job descriptions. If you know anybody who may be interested, please let them know about this. Okay, so next up, we have community health.
Yes, hello everybody. So my name is Leah. I am the Community Health Program Manager here at Neighborhood House. I want to go over a little bit about our programs, what we do, eligibility, and how folks can contact us. So we have a couple of different areas that we focus on. One of the things we can provide both in the community or at our office, which is located in Burien, is we provide rapid HIV and hepatitis C testing. All of our programs are for adults only, so people do need to be 18 years of age or older, but we can provide the rapid testing to those folks. It is free of charge. We do not ask for any information on insurance, and then the results are available within 20 minutes. If there is a positive, we connect folks to care the same day, so no one has to worry about what that would mean. So again, that service is provided both in our offices in Burien, or we can go out to the community with our van. Right now, we do not have open office hours due to COVID, but we can schedule times to meet with folks in safe places. Another service that our team provides is we offer referrals to substance use and or mental health treatment services in the community. So we are partnered with a number of agencies in South King County mostly. Three of our biggest providers are CMAR, Valley Cities, and Navos Mental Health Services. And so we can help folks get connected to care. And then also if people do not have insurance or do not have the ability to get insurance, we can help cover the cost of some of those services. Every situation is different. So if anyone is interested in that, please reach out to us and we can talk about whether or not you'd qualify. And then one other thing we can do is that we can complete coordinated entry assessments for the King County housing. What that is it gets someone into the pool for potentially being eligible for King County housing. There is no guarantee, but it is something that we can provide. So those are our main services that we can provide. If I could get the next slide, please. Thank you. So the qualifications are pretty simple. As I said before, an individual must be 18 years of age or older. We cannot serve anyone under the age of 18 at this time. People must reside in or spend most of their time in King County. We do work mainly with individuals experiencing homelessness or people that are at risk of homelessness. And then it's not a requirement, but many folks also come to us with mental health or substance use treatment needs. And so again, if you have any questions, each individual case is a little bit different. We do have a wonderful team of case managers that work with folks individually. We do monthly check-ins with people so that we make sure that you stay connected to services, stay connected to any needs that you might have. There's two ways to get connected. So a person can call themselves. You do not need an outside referral. You can call yourself at the number on the screen, which is 923-6777. Most of the time that phone won't be answered immediately because we are not in the office, but if you leave a detailed message, we will absolutely get back to you within 2 business days. Please make sure to leave us a callback number so that we can reach out. Another option is to email us directly. Again, the email's on the screen. It's projecthandlenavos@nhwa.org. That goes to our referral coordinator, who then sends it on to a case manager. There's also the option to be referred by an agency. So if someone is already receiving services at, say, Navos or CMAR, and they are interested in our program, their therapist or case manager can also refer to us. And there's just an online form that all those agencies have, but we can also send that along to someone via email. And if for any reason our services are not available to an individual, or something that we can't cover or aren't able to help with, we would absolutely provide referrals to programs either within Neighborhood House or outside Neighborhood House. Wherever someone needs to go, we will help you find those. So that was a very quick overview. Again, self-referrals are fine. People can send referrals from other agencies as well. But the best way to contact us is to call the phone number and leave a message, or send us an email. And that goes to the whole team, so someone will definitely get back to you. Any questions?
If questions pop up into the chat, Leah, we will make sure to go ahead and ask them.
Yeah, absolutely.
Thank you so much for giving us the information about your programs and how you can help people. It is
Thank you.
appreciated. Our next presenter is going to be Amy from Aging and Disability Services.
Good afternoon, everyone. My name is Amy Haru. I am the ADS Aging Disability Services Resource Manager, here to talk to you about Community Living Connections, also known as CLC, and Caregiver Services, FCSP Family Caregiver Support Program, and MTD, which is our Medicaid Transformation Demonstration Project. Next slide, please. So for our Community Living Connections, that is our largest program that we offer resource navigation. We support seniors, and we also support individuals that are receiving care from other family members. With our resource navigation, we help meet your basic needs. If you need assistance applying for food benefits, medical insurance, understanding the difference of Medicaid, Medicare, even looking for utility bill assistance, perhaps internet discount programs. Those are the type of items that our team serves the community with. That's a brief, but a lot of help that our team does. For our Family Caregiver Support Program and MTD program, we support unpaid caregivers and their care receivers. What is an unpaid caregiver? An unpaid caregiver is someone that's taking time out of their day to care for someone else. A care receiver is someone that's receiving support from a loved one so that they can still live independently in a home that is familiar to themselves. They also receive resource navigation assistance. We help and assess whether in-home services is what is needed in the home. Is it grocery delivery? Is it personal care needing items to get out of the bathroom or to meet their personal care needs, medication delivery, respite, any type of medical equipment that we can help get into the home so that those care receivers can live in their home for a longer amount of time. Next slide. So with these services, we actually have a team of 23. We offer our services in the following languages: Arabic, Amharic, Tigrinya, Cambodian, Spanish, Krishayan, Chinese, Vietnamese, Russian, Ukrainian, and Somali. Many of our staff are available by email and cell phones. We are working remotely at this time and are not in offices. Some of our office time is primarily for signatures for documents. So I just want to give you all a heads up of that. Also for other services, we're able to offer external provider referrals too, and provide the wraparound service of following up to make sure your documents are received and that you understand the following steps to retain that service. And so you'll see here the eligibility and who to contact. I'll also put it in the chat as well. For our community living connection services, you must live in South King County, be 55 or older, or 18 older with a disability. The disability does not need to be medically diagnosed, just to let you know. And then for FCSP and MTD, you must qualify and live in South King County and identify yourself as a caregiver or care receiver. And with that, I will put the contacts of individuals. We have a resource coordinator, Valentina, a resource supervisor, Marion, care coordination supervisor is Wendison, and myself as the resource manager. All their phone numbers and emails are in the chat. Any questions?
Amy, when you say it doesn't need to be medically diagnosed, can you expand on that a little bit? What do you mean?
Yeah, it does not need to be a medically diagnosis from a doctor. It could be even your own personal feels of PTSD, post-traumatic stress, coming to a new community, not understanding the English language, also navigating these systems that we have with Department of Social Health Services, Social Security Department, many of the different providers that we work with day in and day out. Like, that's not easy to understand. And did that answer it, Rochelle?
It does. So if they reach out to you, then you can help them get on like SNAP and help them figure out that whole system, right? Thank you, Amy. Next, we are going to be talking to you about rental assistance, and this will be brought to you by Brianna.
Yeah, thank you so much. At Neighborhood House, we have a number of programs that support housing stability, and I'm going to focus right now on our rental assistance programs, and we can get right into it on the next slide. So we have two key rental assistance programs currently. The first one is for City of Seattle residents. It's called Homelessness Prevention is the title of the programming that you'll find in the City of Seattle website. But basically we assist families or individuals in the City of Seattle who are behind in rent and or at risk of eviction. We support in a variety of ways to kind of help people find strategies that may stabilize their ability to pay rent going forward. But we are able to assist in paying some of the back owed rent in order to stabilize that leasing situation. So that is for the City of Seattle. We also have a program that serves individuals across King County. And you may have heard of it. It's been shared widely around our region, and it's including on King County's website. So it's known as the Eviction Prevention or Rental Assistance Program. And there are a lot of different providers working on it. And so we are one of those providers. And so we can help with questions or connect folks to the provider that maybe they already to see who their case was assigned to, or kind of help navigate that. That program in general assists households living in King County that have been impacted by COVID and who are behind in rent, who owe rent to their current landlord or property manager. The program can assist, depending on a specific situation. It can assist with up to 9 months of back owed rent and utilities. And even up to additional like current month, future couple of months assistance as well. So in order to access that program, people need to pre-register online. There's also a phone number at that website that's on the screen. It's a tenant portal for the program across King County. So that is a requirement first for us to be able to even look up the individual. We are working with, the program is set up so there's a assistance provided to individual tenants, but we also, providers are working with the large landlords who sign up as well so that they can serve as many of their tenants in their buildings that are eligible. So we are working through both of those aspects as well, partnering with landlords to connect with all tenants in their residence that may be eligible, and also assisting individuals as we are able to through navigating the program. Thank you. So just in brief, as I mentioned, the key difference, of course, is that HP, or Homelessness Prevention Program, is kind of an ongoing program that we normally operate, even outside of this kind of COVID recovery time. EPRAP, or the Eviction Prevention and Rental Assistance Program, is a specific COVID recovery program that is not, that has been added in. It started in 2020, and we're in a second round of it essentially now. So for HP, that is from the city of Seattle. So participants must be renters living within the city of Seattle limits, and must be behind on their rent at least 1 month. There is a contact phone number that we have that is there that you can leave a detailed voicemail on. We generally operate the intake line every Monday so that we have a process for scheduling out our week. So the Mondays is when we are receiving the calls and processing through. But if you leave a voicemail, we will get back to you from that following. Each Tuesday, we start going through all of the voicemails that came in on Monday and going through to be able to get back to folks and assist. There's also an email listed there as well, and I can put all of this information in the chat as well. The contact phone number for the City of Seattle Rent Assistance is 206-825-2581. And for the King County-wide program for rental assistance, I can also put that in the chat. There's the external website for the pre-registration. But if you have questions or just said, I pre-registered months ago, what's going on? Or, hey, can Neighborhood House assist at all? You can reach out to us. And any questions about any of the programs for rent assistance, we have put Tanzania Walker program supervisor's contact information on this slide as well. And I can also put that in the chat to summarize.
Well, thank you, Brianna. So that is the conclusion of our presentation of the information we had. Does anybody have any questions? If you think of something later. Here we come. Will we have this PPT available?
PowerPoint.
Oh, okay. Yes, this PowerPoint should be available. What is going to actually happen with this PowerPoint is we're going to take it and turn all the information into a PDF, which will be available on our website. As well as if you want a copy, you can just email any of the emails that you are going to get that you already have. We can send you a copy of that. And I imagine the PowerPoint will be on our website as well. I really appreciate everybody taking their time today to come and participate in this and receive the information that we are giving, as well as the folks who showed up and took time out of the workday to come and give this information.